Hello, everyone, and thank you for tuning into IFFGD's new series titled Research Award Winners, Where Are They Now? This program was designed to not only recognize this year as being IFFGD's 30th anniversary, but also to give us a moment to reconnect with our past Research Award winners and see where they are now. So today we actually have the pleasure of speaking with Dr. Jadcherla, who won the 2011 IFFGD Research Award for Senior Investigator in Pediatrics. Thank you so much for joining us today.
Thank you very much. Thank you.
Yeah, so can you actually just tell us a little bit about where you are and what you're currently doing?
Yeah, I'm a professor of pediatrics at the Ohio State University College of Medicine, and I also work at the Nationwide Children's Hospital and Nationwide Children's Hospital Research Institute in Columbus, Ohio. And I work in the neonatal ICU, and pediatric GI research is my area of expertise. And I've been pursuing research for the last 25 years now, and advanced the areas of inquisitive questioning in terms of finding new things, discovered many new reflexes, new methods of managing feeding difficulties in babies. We have, thanks to IFFGD, we have grown our program very nicely. You know, that was a very nice recognition that we had at that time. And I'm very grateful that I've been consistently and successfully funded from the NIH till now. This will be, with the new grant that we received recently, it will be 25 years of continuous NIH funding, which I think is nice in these troubled times. And not only that, the discoveries that we have made have helped many mothers and babies with developing better feeding capabilities in their babies who have got trouble with feeding. You know, I deal with babies who have feeding difficulties, sucking, swallowing, breathing problems, and tolerating feeds efficiently. Some of these babies are admitted to the ICU and they go through a lot of difficult course. And one of the things that every mother wants is, when can I take my baby home? How best can I feed the baby orally? But these are two major areas that our research is not yet widely known, but we have uncovered many puzzling questions. And we are not only that, we are translating that into clinical practice. And then we have seen wonderful outcomes on minimizing the symptoms of GI symptoms in these babies and helping them eat better, which again is one of the good goals of IFFGD about minimizing the symptoms and recognizing them much earlier on and tackling them head on.
Yeah, and I know you briefly touched on a little bit just about some of the things that your current studies are focusing on as far as the feeding with children. But can you go into a little bit more detail about some of the current studies that you have going on and what you hope to gain from those studies in order to help those who are currently living with those gastrointestinal disorders in children?
Absolutely. Thank you. Great question. So we started with understanding what is normal first. And then I deal with patients under 1 year of age who are very nonverbal, very difficult to identify because they don't say what they have. So therefore, what mother perceives as a problem is what we go by oftentimes, and which mother is almost always right, but sometimes the question comes we may not be able to answer without better methods and techniques. So when we evaluate babies with feeding difficulties, airway problems, or gastroesophageal reflux disease type of symptoms, you know, again, the causes may be many, the mechanisms may be many. So first we developed the methods to understand what is normal. Then subsequently we developed techniques to understand what is abnormal and how to fix the abnormality into normality. So with that, we understood some of these reflexes or abnormalities in premature infants, in infants with chronic lung disease, in infants who have got neuropathology. All of these entities are very frequent in babies that are admitted to the neonatal ICU. And just for you to know that about 10 to 12% of the annual births are admitted to the ICU. So there's a population of about 4 million are born each year. About 10 to 12% are admitted to the ICU, or maybe more, depending upon other conditions. So having developed these methods, our goal is to minimize the feeding difficulties and airway problems and ensure that these babies go home on oral feeds. Now, in those babies that are struggling to feed orally, the long-term feeding strategy is gastrostomy feeding or chronic tube feeding from the nose into the stomach. And these babies are on tube feeds for a long period of time. Some of them end up getting other surgical procedures also. So using our methods and the approaches, we have minimized the need for the gastrostomy tubes by over 50%. So that's incredible outcome-wise. Not only that, when we followed those babies in whom we prevented the gastrostomy, at 2 years of follow-up, they advanced even superior with superior feeding skills, and developmentally they were much more superior from both body development, physical cognitive development, and overall well-being as well. Now, current grant funding that I have from NIH is dealing with infants with swallowing disorders or eating disorders. This is a very specific focused population wherein we are studying both neurologically normal babies and neurologically abnormal babies who have got feeding difficulties. So we are trying to understand how the gut connects with the brain and the brain with the gut in normal and abnormal situations. So some of this information would help us develop better diagnostic markers and also better approaches to modify the abnormality to normality.
Yeah. And I really like how you kind of threw in that statistic there at the beginning of how many children actually do get admitted into intensive care. And then also just understanding that basically a lot of these research studies that you're a part of are to help the quality of life and help these children gain a better quality of life. And I think that's super significant in the field of research, especially in the GI field. So out of all of the research studies that you have been involved in, what would you consider being your biggest successful one, and why?
Thank you. Well, first of all this research is to enhance our understanding, develop new knowledge, and not only that, to implement the knowledge to the bedside. And that's translation. So in my career, now we have over 150 publications, and that has original publications that has resulted in advanced educating people about advanced discoveries and mechanisms and how to recognize problems, or how to fix problems, and so on, pertinent to this patient population. So that is very gratifying, meaning advancing science through research and educating through publication. That's one thing. Second thing is, we are translating as we learn, and that's called action medical research, meaning if I know something new from original research, we can apply that in a some feeding problem setting, and we are making a difference now as opposed to waiting for many years in the future. So with that, we are seeing the best outcomes at Nationwide Children's Hospital. We are seeing the best outcomes. We get referrals from neighboring states, and sometimes I do telephonic or video consults from other states and other countries also. So by listening to them, we are able to make some diagnosis and suggest to those people outside of our unit, as well as in order to make better outcomes. So the most gratifying thing to me was that preventing the chronic tube feeding.
Yeah.
I worry about that because when a baby goes home on chronic tube feeding, it upsets the lifestyle of not only of the baby but also of the parent, and it is very concerning to the mother seeing to tube feed the baby while everyone else is feeding normally. So our major goal was preventing the feeding problems by preventing the G-tube long term, and even not only that, in those babies that went home on G-tube, we developed strategies that would help these babies eat orally thereafter and not depend on the G-tube. So from the data that I shared earlier, that at 2 years, they had superior developmental quotient profiles, from better growth parameters, better cognitive ability, all that. And then they had better milestones. And that is really gratifying, that I could see in my lifetime that the discovery has reached the population where it is really needed and transformed their outcomes.
Yes, just what you said, that your research studies have definitely reached the general population and has definitely transformed the life. And just what you said too, as far as mothers having a newborn in general, it's already a nervous type of feeling that you have when you are taking that newborn home. And to think that you might have to take a newborn home on tube feeding, it's even more of a stressor. And just the fact that some of your research is in the area of eliminating that stress for a new mom is absolutely phenomenal. And so thank you so much for doing that type of research study and conducting those studies to advance the field. And you also mentioned at the beginning where you're receiving some NIH grants. And so what other acknowledgments have you received since winning the IFFGD Research Award in 2011?
So very recently, I've been recognized as a endowed chair of neonatology at the Nationwide Children's Hospital. It's called Nationwide Foundation Endowed Chair in Neonatology. And this is one of the biggest honors that I've received from Nationwide Children's Hospital and Nationwide Children's Foundation. I've also been awarded by Ohio State University as Distinguished Mentor Award across the university. It's called Center for Fame Distinguished Mentor Award. Mm-hmm. Then I also received another one called Research Excellence Award, through the ANMS and IFFGD associated again. So those are some of the things. And I've been invited to speak at multiple areas, and thankfully continued NIH funding thus far in order to pursue this larger cause of helping babies eat better, which I think is very gratifying. Like that, there are many other recognitions, like recognized in the Wall Street Journal for our contributions. Invited editorials by different journals asking me to write, and I've been the president of the Dysphagia Research Society, which is a international society that cares for research across the age spectrum, from pediatrics to geriatrics, in those patients who have got trouble eating or feeding or swallowing. So I rose in the ranks from being a member to the president of that society. It's called president of the Dysphagia Research Society. I didn't stop there. After that, I thought that it's important to educate the people in this field, because sometimes when the problems are very complex, the solution is not simple. The solution lies in education, because when we educate the people, then they understand the different reasons, particularly in a multidisciplinary setting. So we founded within the Dysphagia Research Society, we founded a program called Dysphagia Research Society Institute for Education. So within that, so I'm the founder, chair of that particular institute, and then using through this, under the umbrella of Dysphagia Society, we are developing educational sessions across the globe for everywhere, like using innovative approaches and methods, and training the newer graduates to give them all this cutting edge and newer methods and newer approaches, so that we want to implement these things much earlier than later.
Yes.
In preventing the morbidities. So, these are all things I'm very fortunate to be able to do these things. And we can go on, but these are some of the, noteworthy things that I thought of highlighting.
Yeah, and congratulations to you for all of these acknowledgments. I mean, it's well deserved, and just to think that you're having a hand in mentoring our future physicians, and as well as you're just encouraging the increase in understanding the research while publishing these educational materials for patients and for caregivers. I mean, it's phenomenal to know that you're being recognized for all of the great research that is coming out of your lab. And speaking of the research that you are doing, what specifically do you enjoy by being a researcher?
Well, translating, for discovery, translation, and making an impact on the baby and the parent. And when this happens, not only we are cutting down the costs, enhancing the outcomes, and improving the growth and development of the baby, and it's a happy family. That's what I really enjoy. Another thing is by teaching the young graduates that come to our program, or young fellows that come to our program, we are changing their approach to management, which I think is phenomenal, because they carry all this knowledge and apply in their perspectives. It changes their perspective of the problem. And then not only that, through our societies like pediatric academic societies, or dysphagia research society, or DDW, or ANMS, any of these societies, we also teach to fellows and the students, or whoever is there that comes to the meetings, again, changing their level of understanding of the perspectives. These are some of the things. All these are really gratifying. Yeah.
Yeah, not only gratifying, but then also I think it just helps you just every moment that you're touching each one of these fellows, and every moment that you're interacting with your patients, it shows you another reason why research is so important. And I think that that's also gratifying, and it's comforting to know as a caregiver or a patient with a GI disorder that my doctor cares so much about not only the research part, but me as an individual. And I think that's something that you definitely expressed throughout this interview. So I know we touched on a little bit at the beginning of the interview, but as we begin to kind of wrap things up here, what do you feel would be some of the gap needs in research? And what do you see in the future of research studies for gastrointestinal disorders, or maybe some of the studies that might come out of your lab?
Yeah, great question. I would like to involve parents in my research, so that their level of understanding would be different for their baby's problems, because we rely on the parental input a lot in terms of what tests to do, what tests not to do, or what is the problem, and so on. So I think developing newer approaches to educate the parents, and that would help us improvising their level of understanding, so that we will do testing judiciously and when needed, and or appropriately. So those are some of the things that would come from my lab.
Awesome.
Another thing is developing cutting-edge techniques, methods to manage problems. So developing algorithms. See, when a problem is complex, that is, feeding is a complex entity, feeding problem is a complex entity. So solutions may not be very simple. So we have to develop personalized algorithms. Every baby is unique. Every baby has got a unique problem. So one size may not fit all. One approach may not fit all. So that's where we are working towards developing, relatively simplified opportunities to manage these problems through education programs, not only for parents, but also for the physicians and the nurses, which is important, because ultimately the person that is feeding the baby in a hospital setting is a parent or the nurse. So developing programs for them would help. Yeah, those are some of the things that will come.
Yeah, and it sounds like it's just going to be some really phenomenal things to come out of your lab. And we foresee a whole bunch of research and advancement in the field coming from your lab too. And I'm excited to read even more papers and just to gain a little bit more knowledge, even on my end, about some of these feeding difficulties in children and just how to better treat some of these patients that you do see. And then also just how to care for each one of these children as a caregiver. So thank you so much for your insights in this topic and for just informing us a little bit about the research studies that are going on out there and coming from your lab. And thank you everyone for tuning in to IFFGD's new Research Award winner series titled Where Are They Now? And again, thank you so much for joining us today.
Thank you, Hayley. Thanks so much.